Hi, my name is Vishal, and today I'll be explaining about the poster, the mind map poster that I've done for my thinking skill final project. So, this poster is about COVID-19. COVID-19 is a virus attack, it's a pandemic which is currently going on in our entire world. And my poster is divided into four different parts, which is symptoms, test, precautions, and prevention, and finally the individual at high risk. So, as we can see, symptoms. Symptoms are divided into three categories, which is common symptoms, less common symptoms, and serious symptoms. Common symptoms are like fever, dry cough, and tiredness. This, these three symptoms are very common among citizens or everyone, but the chances of being infected by COVID-19 with these three symptoms are very less. It can be a normal fever, it could be a normal dry cough, or it could be just lacking of sleep, which makes you tired. So the possibilities of being infected with these three symptoms are very low. And then going to less common symptoms such as body pain, sore throat, diarrhea, and then headache. So these symptoms are considered severe because uh, according to the report that we have received from the media, these less common symptoms are shown on the second week of infection. So people who have been confirmed infected, they have gone through all these symptoms before they get admitted in hospital. And finally, serious symptoms. Serious symptoms, we have difficulty in breathing, shortness in breathing, chest pain or pressure in chest, and loss of speech for a moment. Okay. Why all these symptoms are related to our respiratory system? Because this novel coronavirus is a virus which attacks our respiratory system, especially from our throat to lungs. So, as we know, it is a respiratory system attacking virus. So, these are the symptoms that exactly show what is going on in our body. So, next, I'll be talking about tests. So, uh, currently, everywhere in Malaysia or the whole world, they're conducting test over test to check that we are infected or not. So, the method of testing is called nasopharyngeal, and this test is conducted by collecting the sample of nasal secretion from the back of nose, which is they insert, as we can see in this picture, they'll insert a tube-like object in our nose to get the sample from back of our nose and throat. So it's considered going deep inside, and the sample is analyzed by checking the presence of organism or other diseases. So when they check, if they found that the virus, means you're test positive for this COVID-19. And next, I'll be talking about uh, individual at high risk. So not everyone who got infected have high fatality in this case, because people like elderly people and people with AIDS or HIV and people with serious medical conditions are considered to have high fatality due to this virus. Uh, Normal people uh, contains average immune system, but as I mentioned, these three category of people, their immunity is lower than average. So they have no, they have lacking of fighting strength against this virus. People with serious medical condition also can be specifically spoken. Um, First is with chronic lung disease. This comes first because this virus attacks people with respiratory system. So if someone has lung disease, they have very high chance of fatality. And then with people with asthma, severe asthma. So asthma is caused by pollution, and you also uh, consider a pre-stage of lung disease. So it is also dangerous for people with asthma, and then people with heart condition, diabetic patients, and then kidney failure patients. They also have a very weak immune system due to organ failure, or their organs are about to fail. So their body functions are not clear, and this cause for the weak immunity. And next, I'll be talking about precautions and prevention. So first precautions and prevention is usage of soap and water or alcohol-based hand rubs to wash your hands. This kills the bacteria or virus that usually washing hands is to clean our hands. And by using alcohol-based hand rubs will kill the virus in our hand. Second, everyone must maintain safe distance at least 1 meter from another one. So this is considered social distancing. What is social distancing? It's it is like standing from a person approximately 1 meter away, just to not share the virus. It's like this virus is transmitted by water droplets. So if you're standing near to a person and the person cough or sneeze, the droplets might transmit to us, or we could transmit the droplets to others, which could be a high chance, or which will increase the infected rate. And three, avoid touching eyes, nose, and mouth because the hands might have touched any surface that contain virus. So according to studies, this virus can stay alive more than hours in any surfaces. So if we touch a surface and we touch our face or any part of our face, the virus could grow and will get us infected very soon. And fourth is covering our nose or mouth with our bend of elbow. So this is a step of prevention where by doing this we can reduce the chances of us transmitting the virus to others. So this step should be like this. When we sneeze or cough, use our bending part of elbow while closing our nose and mouth. Then number five is staying at home, avoiding crowded place, because in a crowded place we don't know who's infected, and the chances of us getting infected is pretty high compared to being at home all the time. And the last one is to wear surgical mask. The surgical mask is not to prevent you from getting the virus, but it is to avoid you to transmit to others. So when we sneeze or cough while wearing the mask, the droplets might not escape from your facial area. So this will help us to reduce the infection rate. So this is all about my mind map poster. So thank you.